Are you prepping for the NCLEX? Well, let's walk through some key questions that you'll need to know. And if you want a ton of questions with rationales for free, simply click the link in the description below to create your free Simple Nursing NCLEX account. All right, future nurse, let's walk through this case study together. And always remember to mentally highlight the key terms that risk safety. So starting at the top. So step 1 is read the intro and think safety, revolving around nursing ethics. So simply think of 3 things that harms or is unethical. So number 1 is drug diversion. Number 2 could be impairment. And number 3 could be HIPAA or other privacy violations. Now step 2, let's look through the tabs and again, mentally highlight keywords that risk safety. So let's click under tab number 1 of the meeting notes. Okay, we have a lot of information here, but let's look for the keywords. Well, the first thing we're looking at is that the nurse reports that CH, another nurse, asked for a cosign to waste hydrocodone, which is a narcotic, but already had disposed of the tablet in the sharps container. Now, the next thing we're highlighting is that later, apparently, the charge nurse informs that CH, the other crazy nurse, had a nosebleed and went home. Okay, this case study is getting super juicy. Okay, the next one here is waste was not co-signed by another member of the nursing staff. Dun, dun, dun. All right, the next thing we're looking at is that 2 more hydrocodones were dispensed, oh my gosh, this chick is crazy, from the automated medication system and documented as administered in the MAR. Oh man, just taking a little to-go bag too, sheesh. All right, so obviously, jokes aside, this is huge warning signs for potential drug diversion. Okay, the last thing here, which is really interesting, is that CH, the crazy nurse, has been employed for about 15 years. But over the last year has called out sick once a month. Now, that's not too crazy. I do that a lot, actually. But they're often running late, okay, guilty again, and appear agitated. All right, that's not me. Often they use the restroom while on duty and has lost significant amount of weight in the last several months. Ooh. Okay, guys, huge red flags that indicate drug addiction or drug abuse. Now let's click under tab number 2, the review of the medical record. Well, number 1, we're looking at severe pain reported by the client despite the documented administration of prescribed opioids. So this is indicative of drug diversion. All right, talk about a crazy case study here. So step number 3, remember, find the keywords before you dive into the items or each question. All right, now that we've found each key term that risks safety, now you can go through each item more confidently when answering the specific questions. So remember, don't be scared, be prepared. Simply find each key word that risks safety before jumping into the questions. All right, now for the first question. The question's asking, click to highlight the findings that require immediate follow-up. The problem here is staff meets about issues between nurses. So for the solution, before looking at the options, think about safety here. So number 1, we're thinking about drug diversion, or basically taking narcotics and taking them home. And number 2 is thinking about impairment, or basically an altered nurse. Now, number 3 is HIPAA violations, which we didn't really see in the case study. Okay, now let's highlight any concerning findings. So clicking under tab number 1, the meeting notes. The first thing that's really concerning is that they didn't feel comfortable to co-sign waste that they didn't witness. So obviously, that's a huge red flag for drug diversion, or basically stealing narcotics. Now, the second juicy bit of information is we look for the staff later in the shift, and the staff nurse had a nosebleed and then went home. So again, that's a huge red flag right there. Okay, now for the last one here. Hydrocodone was wasted, but not co-signed by another member of the nursing staff. So again, another big indicator that there's probably going to be a big raging party. No. Another indicator of potential drug diversion. So basically, stealing narcotics and taking them home. Okay, now for the next question. This is a really juicy case study. The question's asking for each finding, click to specify if the information indicates drug diversion, behavioral impairment, or physical impairment. The problem is we have a staff member with suspicious behavior. So for the solution, before looking at the options, think about behaviors consistent with potential drug diversion, which is basically stealing narcotics. Behavioral impairment could be related to some type of mood imbalance, and physical impairment could be from a physical ailment. For example, a limp or something that's wrong with the body. All right, now let's dive into the options here, starting with drug diversion. So with drug diversion, are we going to see disposal of controlled substances without a witness? Well, yes, of course. Unconfirmed disposal of controlled substances, can allow theft. So this is classic example of drug diversion. What about leaves work before the end of shift? Well, not necessarily. How about experiences a nosebleed during shift? So remember, with drug diversion, we're simply diverting the drugs or basically taking them home or stealing them. So nosebleed would not apply here. How about wasting controlled substances without being co-signed? Yes, of course. Not following policy for narcotic waste is a huge warning sign for drug diversion. Now, frequent absences, vague health complaints, and weight loss does not apply to drug diversion, but the last one does. Frequent bathroom breaks at work, and it's not just about Chipotle here. It's actually about Taco Bell. No, I'm just kidding. So employees may be using controlled substances in the bathroom. Okay, now moving on to behavioral impairment. So remember, let the name help you here. Behavior is all about the mood. So the first option we can't choose, disposal of controlled substance without a witness. It really doesn't apply, but the second one does. Leaves work before the end of the shift, considered a behavioral impairment. The next two options really don't apply because a nosebleed during the shift is more physical. And if the client wastes a controlled substance without it being co-signed, is not really a mood disorder. What about frequent absences? Well, this is abnormal behavior that's a warning sign of potential substance abuse. Now, the next three don't really apply to behavioral issues because vague health complaints, weight loss, and even frequent bathroom breaks are not mood changes here. Now, the very last one, physical impairment. And once again, let the name help you. It's all about physical, basically the body. So disposing of controlled substances without a witness is not really a physical issue. Neither is leaving work before the end of the shift. But the nosebleed is. Remember, the nose is a part of the physical body. So this can result from snorting substances that can irritate the nasal cavity. Now, the next two are wrong because they don't really apply to the physical body. So wasting controlled substances without being a co-signer and frequent absences are not a physical issue. But vague health complaints is a physical issue, often used as an excuse for absences or to leave early. Also, weight loss is a physical issue associated with self-neglect. And the last option is incorrect because frequent bathroom breaks at work is not technically a physical issue. Okay, now for the drag and drop question, or as I like to say, drag and drop it down low like there's money on the flow, ay. This question is asking us to complete the following sentence by choosing from the list of options. The problem here is suspected drug diversion and nurse impairment. So for the solution, before looking at the options, think about considerations related to suspected drug diversion, or basically drug abuse, and nursing impairment. Well, number one, it can result in client harm. Well, obviously, we don't want a high nurse taking care of patients. So impaired nurses can be unsafe in their judgment and even clinical practice. And number two, we have a potential for clients to experience increased and even unrelieved pain since the nurse has taken all their pain medication. Okay, now let's look at the actual question here. So based on the current information, clients who receive care from the staff nurse are at highest risk for blank as evidenced by blank. So now let's look at the options here. These clients are at highest risk for blank. Will it be unrelieved pain? Well, yes, this is correct. Client's pain is not addressed since that nurse is taking all their pain medication. Now the rest of the options in column 1 are incorrect because dissatisfaction, even though a real concern, is not the biggest top priority or really a safety concern. Neither is sepsis. The meeting notes indicate a mishandling of narcotics, or basically pain meds, and really not antibiotics. Now, what is this unrelieved pain evidenced by? Is it evidenced by poor satisfaction survey scores? Well, no, this is incorrect. It's not indicated from the clinical data. What about the reuse of syringes and needles? Well, no, again, there's no evidence to support this. So the correct option here is not receiving prescribed pharmacotherapy because once again, the staff member is stealing their medications. So this nurse is stealing their pain medications rather than giving it as ordered. This question is asking what should be included in the SUD or substance use disorder policy. Select all that apply. The problem here is developing unit-specific policy for staff substance use disorder. So for the solution, before looking at the options, think of safety and support and always ensure proper protocols are in place. So number 1, ensure clients receive safe care. Number 2 is maintain confidentiality, basically privacy. And then number 3 is follow the chain of command. And then very lastly, it's your duty to report suspicious activity. So now let's look at the options here. The first option is correct. the maintenance of confidentiality. Yes, privacy is key. We only share on a need-to-know basis. The next choice is also correct, a process for auditing medication records. So this helps to detect any drug theft or misuse, even procedures related to meds. And the next two choices are correct, because in option 3, the use of fitness for duty evaluation tool provides objective data about whether a person is a threat to safety. And the fourth option is correct, because a procedure to report suspected impairment ensures proper systems are in place. Now, the last two options are incorrect, because we should follow chain of command rather than confronting peers directly. And the last option, warning signs may be included in teaching. But again, it's not in policy determining consequences for staff substance use. This question is asking us to select 3 priority actions. The problem is the nurse manager notices the staff nurse appears impaired while on duty. So for the solution, before looking at the options, always think about safety first. So we have to think about removing the individual from providing care. And it's your duty to report suspicious activity. Okay, now let's dive into the options. Are we going to remove the nurse from the unit? Yes, of course. Remember, the priority is safety, so impaired nurses should not be giving care. The next 3 options are incorrect, and let me explain why. Terminate the nurse's employment. Although this was pretty close, further investigation is needed before employment can be terminated. What about notifying the State Board of Nursing? Well, this would not be implemented until a full investigation has been completed. How about shadowing the nurse in the provision of the client's care? Well, we should not allow the nurse to continue providing care, so we can't really shadow them if they go home. Now, the last 2 options are correct, and let's break them down. So informing the nurse that a drug screening is required. So remember, drug screening is mandatory because impairment is suspected. And the very last option, evaluate the need for the nurse's emergency treatment. This ensures physical safety of the impaired nurse. All right, let's move on to the next question. This question is asking which finding indicates a need for additional intervention by the nurse manager. The problem here is the staff nurse in question is cleared to return to work after treatment for SUD. So for the solution, before looking at the options, think about safety. Think about the nurse returning to work after receiving treatment for substance abuse. Well, number 1, they must comply with random drug screenings. Number 2 is they should be on time and work well with peers. And number 3, they should ask for help if overwhelmed. Okay, now let's look at the question here. Which finding indicates a need for additional intervention by the nurse manager? The nurse blank. So again, we're looking for the wrong things to do here. So option 1 is incorrect. Complies with random drug screenings is really a good thing to do, so we can't choose it. This does not require additional intervention. Now the next option is correct. They're late to report for duty on 5 occasions in a month. This is a huge warning sign of continued impairment. And the third option is also correct. The nurse isolates herself from co-workers during scheduled shifts. So this is a behavioral finding that may be indicative of SUD. Now the next 2 options are incorrect because the nurse cries when an assigned client is pronounced after a code. Fancy words for the client died, which is an appropriate emotional response. Now the next option, the nurse seeks assistance when overwhelmed during a scheduled shift. Now this is completely normal and doesn't require intervention. Now what about the last option? Administers a controlled substance to an assigned client without supervision. All right. Huge violation of policy about returning to work after a previous drug diversion and even impairment. In this question, we have to drag words from the choices below to fill in each blank in the following sentence. The problem is repositioning the client immediately following a tonsillectomy. So for the solution, before looking at the options, think about safety. What do you know about a tonsillectomy? Well, remember, tonsillectomy is in the back of the throat, so we have to protect the airway. So number 1, position the client onto their side. And number 2, allow blood to drain out of the mouth instead of down the back of the throat. Okay, now let's look at the question. The client has been repositioned correctly if the LPN places the client in a blank position, with most of the body weight borne by the lateral aspect of the blank. So the first thing we're looking for is placing the client on their side, right? So in option 1, this would be incorrect. Lithotomy position places the client on their back. Huge aspiration risk, or basically choking risk. What about the next option? The lateral side. Yes, this improves airway patency, so blood drains out of the mouth instead of down the throat. What about the next option here? Lateral ileum. Well, this one's also correct. It ensures safe distribution of the client's weight and protects the airway. Now, the last few options are incorrect because going supine places the client on their back and could compromise the airway as blood drains down the throat. Also, the dorsal recumbent position is contraindicated. It places the client on their back once again. Now, the last option is incorrect because the cranium position, this is weird. If the client is on their back, weight distribution would rest on the cranium, which is not a good thing. And it could also compromise the airway. Now, let's go to the matrix question. This question is asking, for each staff member below, click to specify the appropriate client to assign for the shift. Each staff member may support more than one client. The problem here is the appropriate assignments as well as delegation. So for the solution, before looking at the options, what do you know about proper delegation? Well, number one, remember, RNs can never delegate what U can eat. U is for unstable clients, E is for evaluation, A is for assessments, and T is for teaching. Now, technically, you can delegate these tasks to an LPN, but you have to avoid words like new, first, or even primary. Now, LPNs should care for stable clients with expected outcomes. And lastly, UAPs or nursing aides can perform standard, unchanging client care tasks. Okay, now let's look at the options here, starting with staff members. So we're talking about a registered nurse here. Let's see what client is most appropriate for the RN. Is it going to be client number one, the 60-year-old male client that has a peripheral IV line with a saline lock and in soft wrist restraints? Well, this client is stable and within normal limits, so it's really not best suited for the RN. The RN can simply delegate this one. What about the next client? A 50-year-old female with right subclavian life support receiving several IV antibiotics and IV pain medications. Well, yes, it requires an RN to administer these IV medications, since an LPN and a UAP cannot administer these drugs. What about the last one here? A 74-year-old male client with a central line and receiving no IV medications. Well, yes, this client is stable with a central line that is currently not in use, so we can delegate this to an LPN. Okay, now moving on to the LPN, the licensed practical nurse. So option one is appropriate for the LPN. A 56-year-old female client with a central line that is capped off, receiving no IV medications for a surgery on that left wrist. So yes, this client is within normal limits, scheduled for that upcoming surgery, so this client is stable. Now the next option is incorrect, because remember, only the RN can administer IV push medications. The key term there is IV push. And the last one here is also incorrect. The LPN should not administer medications via a central line. Now moving on to the unlicensed assistant personnel. Fancy words for a nursing aide. So option one is incorrect. This is a potentially unstable client. The RN should assist this client. The next option is also incorrect because assessment is required, and it's outside of the scope of practice for the UAP to do assessments. Now the last option is correct. Bathing a stable client is a standard and unchanging procedure, so we can delegate the stable client. The question's asking for each task, click to specify if the registered nurse or UAP is a better choice to perform the task. The problem here is appropriate delegation. So for the solution, before looking at the options, what do you know about delegation? Well, number one, never delegate what you can eat. So for RNs, unstable clients for you, E for evaluation, A for assessment, and T for teaching. And number two, UAPs or nursing aides can perform standard, unchanging client tasks. Okay, now let's look at the chart here. So first up, we have disconnect and reconnect IV lines. Okay, only done by the RN, definitely not a UAP. How about initiating blood transfusions? Holy moly, a UAP cannot do that. I can barely do that, so only the RN can do that. How about hanging an IV piggyback medication? Well, yes, on the NCLEX, only RNs can give IV piggybacks as well as IV push, even blood products. What about emptying and measuring urine output from a collection bag? Now, yes, the RN can do it as well as an LPN, but it's mostly suited for a UAP here. Because remember, on the NCLEX, we want to delegate standard, unchanging care tasks, which are most appropriate for the UAP. Now, the next one here, hang an IV electrolyte replacement. Oh my gosh, again with the IV. It has to be done by the RN. And the last one here, take a client for their third walk following surgery. Man, this client gets walked more than my dog. So of course, the UAP can do this. And look at the key terms here. Their third walk after surgery. Now, it would be completely different if there was their first or primary walk immediately after surgery. The RN would be better suited for that. But since it's their third walk, the UAP can perform standard tasks for stable clients. You need more practice? Well, let's break down this bow tie question. All right, now for the good old bow tie. The question's asking us to complete the diagram by dragging from the choices to identify, number 1, the condition, number 2, the actions to address the condition, basically how to save the client's life, and number 3, parameters to monitor for to keep the client safe. Now, in terms of the problem, let's look at our case study and find the keywords that risk safety. So, starting at the top here, we see the nurse delegated the straight catheterization of a client's bladder to an LPN or LVN, and it sounds simple enough, right? So let's click under the tabs and see what else we find. So tab number 1, we find the client is an 86-year-old male. So this client is of older age, and they have a bladder scanner. So it could be from an enlarged prostate or really some other urinary retention issue. And the client is admitted for pneumonia. So remember, pneumonia is an infection in the lungs, and infections can migrate to other parts of the body. And the other thing I'm looking at here is IV antibiotics ending in cillin. So remember, cillins can be very harsh on the kidneys. Now let's click over to tab number 2. We see a bladder scanner is ordered every 8 hours, and residuals over 250 mLs, we have to do a catheter. Now clicking over to tab number 3. The bladder scan showed 450 mLs of urine in the bladder. And the client received bladder irrigation at 125 mLs per hour, but they haven't voided in the past 8 hours. Now, the client also stated that they had to go so bad, but can't go. And they go a little, and then they stop. Now, it sounds a lot like urge incontinence to me. Now, the very last thing I'm looking at is that there was another attempt to insert the catheter, and then the LPN or LVN goes to get the RN. So for the solution, before looking at the options, based on our data findings, what do you think harms this client first? Well, number 1, I'm thinking an enlarged prostate, BPH, which I call BPH, a big prostate that holds back urine. And the data shows this, right? Because the bladder scanner we see holding back of urine. The client is also 86 years old and a male, and the client is holding 450 mLs of urine. The client also states they have to go so bad but can't go, and then they go a little, and then they stop. So it sounds like a big prostate that's holding back urine. Also, there were a few attempts to do a catheter, but all have failed. And it sounds like this big prostate is not letting the catheter advance. Now, let's look at the options here. Option 1 is incorrect. It's not a UTI. There's no data that shows an infection in the bladder. The client would present with burning sensation upon urination or even ALOC, that altered level of consciousness, especially because they're old. Now, option 2 is correct here. BPH, the benign prostatic hyperplasia, or simply think BPH is that big prostate that H holds back urine. Now, the rest of the options are incorrect, and let me explain why. Because in option 3, testicular torsion is simply the twisting of the testes, but this results in sudden intense pain inside the testicular area. And the last option is incorrect because in dehydration, we would see skin signs that are dry. For example, dry mucous membranes and not 450 mLs of urine stuck inside the bladder. And we would also see lab values that are completely off because remember, when the body is dry, lab values appear high. All right, now moving on to the actions to take. So again, before looking at the options, think about the data in the case study, and then think about the actions that you would do to save the client's life. So think about treating BPH and urine in the bladder. Okay, now let's look at the options. So for option number 1, would we attempt catheterization with a Coude catheter? Well, if you didn't know what this is, it's actually a specialized catheter with a stiff, curvy tip, kind of like a 7-Eleven Slurpee straw. Now, it doesn't have a flimsy wiggle worm tip like a regular Foley. It actually helps sneak around hard surfaces like the prostate. So this option would be the most correct. Now, the next few options are incorrect, and let me explain why. Because in option 2, giving IV antibiotics is not right. There's no data that suggests a big infection, so we don't want to do that. And in option 3, IV furosemide, guys, IV furosemide is a diuretic. Think about it. It ends in "ide," so it makes the body dry. So again, let the case study help you. There's no information inside the case study that shows fluid volume overload. We would see JVD, high blood pressure, or things that show the client is retaining water. Now, option 4 is correct. We want to manage the urinary retention. This is the number one thing, since the client nearly has half a liter inside their bladder. Now, the last option, option 5, is incorrect, because giving normal saline IV as a bolus would actually make everything a lot worse. Because remember, let the case study help you. The client has a full bladder, so giving more IV fluid is going to make things worse. Okay, now moving on to parameters to monitor for. So before looking at the options, remember, always let the case study help you. What would you monitor to keep this client safe? So number one, we have to be thinking about urinary output. We need that 450 mLs out of the body and into the potty. And number 2 is possible urgency to void. Now let's look at the options here. Option 1 is correct. Urine output is the desired outcome, so we need the client to void. The next option is also correct. Post-void residuals. This is fancy words for the amount of urine retained in the bladder after voluntary voiding. So we have to assess how much is actually retained after the client voids. Option 3 is also correct. Urine characteristics, because retained urine can retain infection inside the body, kind of like a cesspool or basically a sewer. These clients can get an infection resulting in a UTI, and if getting bad enough, it can climb through your ureters and infect the kidneys. Now, the last two options are incorrect because in option 4, skin turgor is really assessing dehydration, and there's no data in the case study to support this. And in option 5, a red blood cell count is really only used to assess clients with low blood volume, like those with anemia, or even those with a bleeding issue, like someone in a trauma. And there's really no data in the case study to support that. So always remember, let the case study help you. Wow, NGN questions are no joke, but you're doing great. Get access to way more NGN questions, plus all of this. And you can sign up for free by simply clicking the link in the description below.